Massive quantities of grain spilled across Beirut's harbor. Another crisis looming for the city as food supplies become more scarce. Rescue teams have had a hard time looking for survivors. Buildings are smashed together. Finding spaces where people may still be trapped is a race against time. Our experience is that people can still be found alive up to 80 hours after an explosion or an earthquake, so we still have hope. 16 port workers have been detained. Others are under house arrest as public anger grows. Protests broke out overnight following months of demonstrations against corruption and cronyism. Many see the explosions as the result of official incompetence. The ammonium nitrate was stored improperly for more than 6 years. It appears to have come to Beirut in 2013 on a cargo ship that was seized in the port. The ship's Russian captain says Lebanese officials were not ignorant about what they were dealing with.
Они это прекрасно знали.
The authorities knew it was dangerous cargo. They should have paid the owner to take it away. Instead, they seized the ship. Despite everything, volunteers are helping build a makeshift hospital for the most desperate cases. Reconstructing the rest of what's been lost will be a massive undertaking.
Well, for more, we're joined by Lisa Hastert. She's with the EU's humanitarian aid mission ECHO in the Lebanese capital. Lisa, 5 days from the blast that shook the city, how is life for people of Beirut?
Hello, Anthony. So I would say from what I see in the city, people are obviously still they're shaken. It came as a shock to everyone. The destruction is widespread. So the port area, as has been said, is completely destroyed. There is significant damage to the residential buildings in the vicinity of the port area. So obviously people are still a bit shell-shocked.
So pretty clearly from the way you describe it, there is much that is needed in Beirut. But what is it currently that is the most urgently needed?
So I think the priorities at the moment are the ongoing search and rescue operations. So there are still teams on the ground, there are search and rescue teams, chemical assessment teams, there are medical teams in the port area and the residential area around. So that is the very first priority at the moment. But of course, with the silos being destroyed in the port area, the food security, the food situation is of concern, as the World Food Programme has also raised the alert to. And then the healthcare situation is another major concern. So the blast has already damaged significant infrastructure, including hospitals, including health points. So we know that there are 3 major hospitals in Beirut that have been heavily damaged, and that comes in a situation where the healthcare system was already under heavy strain due to the COVID-19 situation, and the frontline workers are exhausted.
Yeah, you speak to the medical facilities that have been destroyed. We heard of patients at the time, straight after the blast, being turned away in the immediate aftermath. How are those medical services coping now under these difficult scenarios?
I mean, there is definitely a shortage of medicine and medical equipment also due to the blast, because some medicine reserves have also been destroyed in that blast. So there are huge needs, I would say. The EU, for example, is at the moment shipping medical equipment and medicines, which was requested by the Lebanese government. So over the last couple of days, there are 5 tons of medical equipment and medicines that have arrived here in Lebanon that were shipped by EU member states. And then, of course, also teams, and there are some medical teams mainly on the sites where the blast happened that are still active and that also have been sent through the EU civil protection mechanism.
Lisa Hastert from the EU's humanitarian aid mission ECHO in the Lebanese capital, Beirut. Thanks for your time.